Good morning, everyone. We will get started in just a moment. Good morning, everyone. Welcome to the webinar, Caring for Loved Ones with Cancer, a guide for families with limited resources. This webinar is being presented to you by the Louisiana Campaign for Tobacco-Free Living, a program of the Louisiana Public Health Institute, and a program of the Louisiana Cancer Research Center. This is our Empowering Community series. For those of you that are attending that are seeking CEUs, at the end of this webinar, we'll provide the information of how you can obtain your certificates for 1 hour credit for social work and 1 hour credit for continuing health education specialists and master continuing health education specialists. About TFL's Empowering People Community series, the Louisiana Campaign for Tobacco-Free Living understands that an essential action of health equity is building capacity of individuals and communities. Thus, TFL devoted the Empower People Community Series to The Louisiana Campaign for Tobacco-Free Living understands that the essential action of health equity is building the capacity of individuals and communities. Thus, TFL has developed the Empower People Community Series, EPCS. This series consists of educational events, virtually and hybrid, such as this one, coordinated by TFL staff featuring stakeholders, partners, community members, and more. From public health policy, medical communities, community advocates, and subject matter experts to reach professionals and community members from across Louisiana and beyond. The mission of the Empowering People Community Series is equitably bringing health education, resources, and hope to people, populations, and communities in Louisiana. Thank you again for joining us today. I will now introduce our Senior Director of Tobacco Control and Prevention and the Louisiana Campaign for Tobacco-Free Living and the Director of the Louisiana Cancer Research Center's Office of Community Outreach and Engagement. We'll have a word from Dr. Nucleus Benjamin Robinson.
Good morning, everyone, and thank you so much for that introduction, Michelle. I hope everyone can hear me. We are glad to be having this discussion today about guidance for families with unlimited resources, caring for loved ones with cancer. We at the Louisiana Cancer Research Center, Office of Community Outreach and Engagement, and also at the Louisiana Campaign for Tobacco-Free Living are devoted to making certain that all Louisianans, and I mean all Louisianans, are aware of the dangers of tobacco use and other vaping products, and also aware of the resources for those individuals who are wanting to quit, and also screening resources that are available inside the state. So this conversation is timely. I hope that in today's conversation, you leave the conversation wanting to do something, wanting to share information with people, wanting to connect people to resources. Please make certain that you are paying attention to the words that are being said by our panelists and our speakers today, because they're here to make certain that individuals in your respective community are getting the information and the resources needed to make the decisions that can help them to live a healthier or a better life, and also help inform them about what are some resources that may be available to their family members who have received a cancer diagnosis. In the state of Louisiana, on an annual basis, about 26,000 individuals get a cancer diagnosis and 9,000 individuals die annually. And so we want to make certain that we are doing our due diligence at Louisiana Cancer Research Center, Office of Community Outreach and Engagement, and at Louisiana Campaign for Tobacco-Free Living. We want to make sure that we're doing our due diligence to inform and empower communities to make the changes needed in their lives to live the healthiest life that they can live, but also to access resources that are available inside their community. So without further ado, we'll go ahead and get this conversation started. Again, thank you guys so much for joining us.
Thank you, Dr. Benjamin Robinson. We'll now go to and introduce today's moderator, Ms. Maddie Hawkins. Maddie Hawkins is our community leader, health equity advocate, and program development expert. I'll read briefly of her bio. Maddie Hawkins is a seasoned professional with a passion for community engagement, public health, and fostering inclusive environments. With a Master's of Science in Health and Kinesiology from Southeastern Louisiana University and certifications in Diversity, Equity, and Inclusion, Maddie brings a unique blend of academic knowledge and practical experience to every initiative she undertakes. Currently serving as the South Central Louisiana Regional Manager for the Louisiana Campaign for Tobacco-Free Living, TFL, Maddie leads transformative programs that align with health equity goals. Her work includes advocating for smoke-free policies, building coalitions, and facilitating public health campaigns that improve community outcomes. Through her leadership, she has successfully established partnerships that drive statewide tobacco prevention efforts. Lastly, Maddie expertise spans advocacy, program development, cultural sensitivity, and strategic planning. Whether she is leading public health initiatives, facilitating community outreach, or mentoring future leaders, Maddie consistently delivers impactful results. Her ability to inspire collaboration and drive meaningful change makes her a trusted leader and advocate in every space she occupies. When she's not leading initiatives or coaching, Maddie can be found delivering impactful presentations on topics such as leadership, diversity, and cultural sensitivity, reflecting the commitment to lifelong learning and empowering others. With her deep-rooted dedication to community well-being and equity, Maddie Hawkins continues to make a lasting impact across Louisiana and beyond. I now introduce you to Maddie, and she'll now be our facilitator for the rest of the webinar.
Awesome. Good morning. I'm so glad that we're hosting this webinar. I'm so glad that you all decided to join to hear this powerful message, to hear this powerful story. And I'm so honored to have these guest speakers and panelists join us today. They'll be giving you useful information, their personal experience. And I'm ready to tell my story. I'm ready to tell my story. I finally received permission from my dad to tell his story about 30 minutes ago. So he didn't know that I was doing this webinar on him. So I finally received his permission. I hope he's actually on the call. So we're going to jump right into it. So first, we're going to go over the learning objectives. So first, I want you all to understand the challenges of caregiving. We're going to explore the different support systems and also ways to develop self-care strategies. So about a year and a half ago, my dad, he was diagnosed with non-Hodgkin's lymphoma cancer. It was stage 3. My dad, he's a doer. He's loving. If you know him, he's willing to give his last. And also, my dad was a smoker for 50 years. So if he had any type of cancer, I would have thought it would have been lung cancer. But it was not lung cancer. It was just a random day. My mom kept telling me, you need to tell your daddy to go to the doctor. You need to tell your daddy to go to the doctor. As you know, men are pretty stubborn and they do not go to the doctor. My dad had this large knot on his neck. And what I know from, working at Mary Perkins Cancer Center, when you see strange things or these big knots or anything of that nature, it's a lymph node and it's possibly cancerous. So when I finally seen a knot on his neck, I just took a look at him and I asked, I say, what's on your neck? What's going on? He was like, I don't know. It's been here for a while. I'm all right. I say, no, Daddy, you're not. And I really think you need to go to the doctor to get that checked out. It's possible that it could be cancerous. So he finally went to the doctor. And so, of course, they had to do the biopsy, different tests, different things like that. So throughout this whole process, my dad didn't say a word. He didn't say a thing. And it was very frustrating because, like I said, I have prior knowledge to working in the cancer field. So I'm asking him, well, what did they say? And he was like, they didn't say nothing. It's all right. I don't know. So when he did tell me certain things, it was bits and pieces. So I'm trying to piece together what it is that he's been told. So I'm trying to do research. So then my mom is asking me all these questions. And I'm like, Mama, not right now. I really don't know. So I can't tell you. So when it came to my dad's cancer journey, he didn't share much information. So when it was time for appointments and different things, we didn't know. I remember one day he told us that he had an appointment. And so I went to the house and I was like, okay, what time is your appointment? So he was like, it's for 12. And I was like, okay, well, where is it? He was like, it's up the street. Okay, what's up the street? So then he went on to say, well, it's for 12 o'clock. So he has on his one thing about my dad, he dresses well. He dresses real nice. So he's all dressed up, sitting outside. So me thinking I'm finna go to an appointment with my dad. He's leaving out and he tells me, baby, this is just something I have to do by myself. So now at this point, I'm sitting outside crying because I feel like he's not letting me in on what's going on with him. So pretty much with that, I had to take a step back and just realize and also process that this is his journey and he's processing it differently than how we expect him to process it. So it was a whole process and a whole journey, just understanding that he needed to do this for himself because for one, this is new for him too, you know? And so throughout that process, my dad like I said, my dad was a smoker. And he was having problems with his breathing. So as you know, with TFL, we have the quit line. So one day I was just like, you know what? I'm going to call you and then we're going to call the quit line. And so through the questionnaire with the quit line, I learned that my dad had been a smoker for 50 years. He started smoking when he was 15 years old. And at the time, he had just made 65. And he was willing to quit because at this point, you know, he's having problems with his breathing. He even had to go back to the hospital because they said he had double pneumonia in both of his lungs, emphysema. And another issue that was presented as well, he's an entrepreneur. So he didn't have insurance. So it may have been he was 64 at the time. So he had to wait till he was 65 to be able to qualify for the red, white, and blue card. So those are some of the issues and just some of the things that happened along his cancer journey. But I would like to say he's cancer free and he does not smoke. So he ended up going cold turkey after he noticed it was life or death. So yes, I'm thankful for that. So we're going to get into our first speaker, Miss Nancy Gosserin. So I'm going to read her bio. So Nancy has been named the Director of Cancer Services, formerly Clinical Practice Manager of Medical Oncology, LLC, located within Mayberry Perkins, Our Lady of the Lake Cancer Center. Gosserin is now responsible for the oversight of cancer services day-to-day operations. Nancy's ability to practice servant leadership as well as display a broad range of knowledge across all organizational aspects has always been a hallmark of her career, said Camille Conaway, Board of Managers member, Cancer Services. The organization is thrilled to welcome her aboard our team, as we know she will represent the organization with dedication and passion, always putting our clients first. In addition to her long-term involvement in the medical field, Gosserin has achieved many firsts and leadership opportunities in her career. She spearheaded the first customer service and training video for Our Lady of the Lake Physician Group, was responsible for the startup of various clinics, and accepted the role of the first hospital-based clinical manager and was operations director of 8 surgical clinics. Employed by Our Lady of the Lake Physician Group for more than 21 years, Gosserin was the 2017 recipient of the Customer Service Award by the Head and Neck Center, and she was the 2005 and 2010 recipient of the Spirit Award for Employee Satisfaction. She is a native of Biloxi, Mississippi. Gosserin also attended Southwestern Louisiana University. So without further ado, we're going to hand it over to our first speaker of today's webinar.
Good afternoon. My name is Nancy Gosserin. Thank you for the introduction, Maddie. And we will tell you a little bit about what we do here at Cancer Services. We have a lot of wonderful resources that we can offer clients. Next slide, please. Who are we? Cancer Services opened back in 1959 to serve tangible needs to people who are living with cancer in the Baton Rouge area. Listed below, you'll see the 10 different parishes that we cater to for our clients. They are actually referred to us by oncologists or dietitians. Our goal is to empower cancer patients and their families' health by meeting financial, educational, and emotional needs that arise during their cancer journey. All services that we do provide are free of charge. And how do you get registered with us? You can get with your social worker, your oncologist, or you could also self-refer. If you self-refer, we also will send over information. You will have to ask your oncologist to make sure they fill out the paperwork, because we do work with grants and donations, and we do have to abide by the grant or the donor's wish on how we use those funds and have accountability. So that is a reason for verification. Next slide. What do we provide here at Cancer Services? We do offer nutritional supplements, and I will tell you that nutritional supplements are probably one of the highest requested items here at Cancer Services. Most people who have chemo or radiation, what happens is they do have different, in their throat, they have a lot of different sores that can break out, and so it's harder for them to eat or to chew. So thus, we have a lot of weight loss on clients. So we do have a special formula we use for the providers and the dietitians to verify how much weight loss a patient has so that they qualify for the boost that we use. And we do honor that for 6 months. And if somebody needs assistance more than that, then we can extend it. Medical supplies. People don't think of medical supplies, but after you have surgery, you may need things such as gauze and tapes and to protect the port where you get your medication, medication. We do offer pull-ups, which we give clients, just so you know, 3 bags of pull-ups with 20 each in a bag. That's only 60. So that really doesn't even actually get them through the whole month. And what happens is you do have a lot of, you tend to urinate much more and have no control of your bladder at times when going through treatment. And so this is another big expense that people need to know that we raise money for, because they're very costly, even if you were to go purchase them. Pads, under pads, pull-ups, they're very essential to people with cancer. Some supplies we have that are for certain diagnoses. For example, ostomy bags. They're very expensive, and their supplies are expensive, so that, of course, is for the certain diagnosed patients. Medical equipment, we do offer for 6 months things such as bath stools, bedside commode, canes, shower chairs, and walkers. For example, if somebody is weak, they can no longer stand as long in the shower. So having that shower chair is critical. Even the bedside commode, you may not be strong enough to get to the ladies' room or men's room. So having it right next to your bed is very convenient. We also have a wig boutique where we are very fortunate to have a large number of donated human hair wigs that we're very thankful for. They were donated by another organization in Biloxi, Mississippi, and we are allowed to offer our clients 4 different wigs and 2 different turbans or hats or scarves. So that is a blessing. Next slide. For financial assistance, we do offer one payment of $150 for financial aid, and this is going to clients who meet a certain guideline. We do have a couple, I'll say, specific diagnosis grants. For example, ovarian. We do offer ovarian clients a $300 grant because that is what the grantor allows us to give. And we also have a prostate grant that's also $300. We have one grant that is $500, and that is for children with cancer. So again, if you don't have those 3, then it's $150 if you qualify for those grants. support groups. That is something that we all need emotionally to help. And we have a plethora of support groups, such as our healing arts, pop and Pilates, prostate cancer, breast and GYN, blood and cancer, oral head and neck. And we just started our coffee talk about 3 months ago, and a pancreatic as well. We're constantly looking for new support groups, and right now we do them. We can do them virtual as well as in person. Again, check our website and they'll list everything we do on a calendar, and you can always sign up. It's very easy. We have a lot of QR codes that makes it a little bit easier as well. One of the best things I think we do have here is what we call emotional health care, and that constitutes counseling. Without going through your cancer journey, that is probably one of the biggest things that we see where people may not want to hear the word counseling. So we say, we're going to talk, because it's critical when you are going through a journey. It not only affects the cancer client themselves, as Maddie suggested, but the family too is affected. And so we not only offer the client the opportunity to talk with social worker one-on-one, they can do it with their spouse or their family, and they also can talk to the family members one-on-one. And again, anybody in the family can talk at no cost. And that to me is the village that we have to create to support that cancer client. So counseling is very huge to us, and we actually have seen quite a growth in these probably the last 8 months. So we're very fortunate to offer that again at no cost. Next slide. Thank you very much for anybody who supports cancer services, and we love what you do here, Maddie, and your team for Tobacco-Free Living, because it does take a village, and if anybody could help donate, that always goes straight back into our Baton Rouge area and the 10 parishes. So we thank you very much, and we appreciate it, and we're glad to be part of this.
Awesome. Thank you so much, Nancy. So next, we're going to have our other two speakers, our panelists, and I'll read their bios. And what I appreciate so much about them, they have a personal connection. They have a personal story while dealing with everyday life stressors, while still being career women, family women, friends. So I'm very grateful to have both of these ladies on the call. So first up, we have Miss Natasha Gay. She is a board certified family nurse practitioner by the American Nurses Credentialing Center. She has a Master's of Science in Nursing Practice and also a Bachelor's of Science from Southern University. Natasha has been a nurse practitioner at RKM Primary in Jackson, Louisiana for 1.5 years, and she is also an adjunct instructor at Southern University Nursing School. Natasha is passionate about teaching and utilizing a preventative approach with her patients and students. She is committed to providing comprehensive patient-centered care with a focus on preventative health and chronic disease management. Now we have Miss Ashanti Black. She was born in Danbury, Connecticut, and raised in Montgomery, Alabama. She earned a master's degree in clinical psychology and has been married to John Black for 16 years. Together they have 3 children, London, John, and Hannah. The family resides in Swedesboro, New Jersey. For nearly 15 years, Ashanti has been with the Federal Bureau of Prisons. She began her career as a drug treatment specialist, providing substance use treatment to incarcerated individuals. Currently, she works in the Northeast Regional Office in Philadelphia and serves as a community treatment oversight specialist, overseeing contracted treatment providers who assist individuals transitioning back into the community. So we're going to have Miss Natasha to lead us first, and then after that, Miss Ashanti, and then we're going to get into the question and answers that we have.
Okay, so good morning. Thank you guys so much for having me. I really appreciate Maddie reaching out to me about this. I was very, very excited to be a panelist. Just a little small story. My mom is a cancer survivor. She had cancer. We found out last year around this time. But thanks to God, she is now cancer free. And I'm just going to kind of share my experience as a caregiver and a healthcare provider. So my experience as a healthcare provider has been a very rewarding one. Being in the healthcare field was always a dream of mine, and now the dream has become a reality. I get to be an intricate part of a person's life by providing the absolute best care possible. I have always had a strong desire to help others and care for family members and my friends early on, which showed me how rewarding it is to make a positive difference in someone's life. I started my professional career as a registered nurse at Women's Hospital, and now I'm a nurse practitioner at RKM and Southern University. An achievement that I will forever be grateful for myself. As a provider and a caregiver, you have to be very patient, but also firm. At the same time, it is great to have someone that has a medical background to go on with you throughout this journey. I tell people all the time that my mom was my worst patient. And I say that in the most humblest way. I love my mom dearest, but it was very, very hard for me to tell her and to be firm with her on everything that needs to be done as far as taking her medications, eating. Any little bitty thing she thought I was being mean to her. But you have to be to get her through the process. And I told her last year around this time, like, Mom, in another year, you're gonna say thank you. Just for being that firm person. Because my sister was the one who was babying her through the whole way. But I definitely thank God for everything that we have been through and we've gotten through it. So I do encourage anyone who wants to join the healthcare field to do so. Because the feeling that you get just knowing that you help change someone's life is truly unmatched. Also being an advocate for effective communication for healthcare providers. You always want to advocate effective communication with your healthcare providers. It's the key to receiving the best care. First, you always want to prepare for the appointments by writing down any symptoms or any questions that you have. Be clear and honest about your health. And if something is unclear, don't hesitate to ask for clarification. Ask questions to fully understand your diagnosis and treatment options. Listen actively, actively to provide to your provider's advice. Take notes. Don't be afraid to ask follow-up questions. If you need to bring a support person to help with information and questions, someone was always there at her appointments. If it wasn't me, it was my dad or my sister or my brother. Someone was always there because in that moment in time, the patient is not actually there, but they're there. So we've always follow up with questions or the medications that she was taking. You want to ask questions. Why are you taking your medications? What are they for? It's always important to collaborate with your provider on a care plan that fits your needs. You want to respect their time, of course, but make sure your most important concerns are addressed. And after the appointment, if you have follow-up questions, then follow up. Take the time to educate yourself about your conditions and your medications. And lastly, always give feedback. If the communication wasn't effective, have clear, open dialogue with your healthcare providers. It's very vital for the better care in your outcomes. Thank you.
Awesome. Thank you so much for that. I like how you said that the patient is there, but they're actually not there in the moment. And although it was my dad's process, I feel like he didn't let anyone in on that moment. So him taking in all this information, which is probably why he couldn't come back and tell us what was actually going on. So that makes a lot of sense. So now we're going to go to Miss Ashanti. So Ashanti, if you could just tell us your personal experience and your perspective of being a caregiver of a loved one with cancer.
Sure. Yes. I actually had a very recent personal experience that occurred as a caregiver. And just a little background. So my husband was diagnosed with cancer in August of last year. So he began his chemotherapy. Then he had major surgery, and just 2 weeks ago, we resumed chemotherapy again. And so this experience actually just happened 2 weeks ago. And so we were getting him scheduled for his chemotherapy session. And so it was right after the surgery. So they're waiting to give his body time to heal and prepare. And so they came in, it's like, okay, we can squeeze you in this Monday, but you have to be there at 7:30 in the morning. Now, like I said earlier, I have 3 children. My youngest one is in 1st grade. So my oldest 2, they're able to get out. And
Oh no, Ashanti, we may have lost you. Let's see. Give us a brief second. As you know, technology does what it wants to do when it wants to do it. So bear with us.
And Maddie, while we're waiting, I can share. Can you hear me?
Yes.
Okay, I can share with everybody. What caregiver support group is one of the biggest requests we have. And so I appreciate y'all talking about, caregivers, because that has been a challenge. Even though we have the support group, we are struggling to, they're struggling to actually come to the support group because of the time in their day taking care of the loved one. And it's hard for them to get away. So that's sort of why it's really important for us to do virtual as well. So we want to throw that out there because caregivers are essential, but they also need a timeout so they can regroup and also have someone chat with them.
Thank you so much for that, Nancy. Shanti, are you back? Is it okay?
yes, I'm sorry. My completely lost signal. So I just let me start over. I apologize about that. So what happened was, so a personal experience was we were given that time to at 7:30 in the morning, and so we had to figure out what we were going to do. So, well, basically, I felt like I needed to figure out what I was going to do about my daughter getting to school that morning at 7:30 in the morning. So I ran this huge plan. I was going to drop him off at the doctor's appointment, which is in Philadelphia, which is like 40 minutes from us, because I didn't want him to drive after chemo for 40 minutes. So I told myself, okay, I'm gonna get everybody up. I'm gonna take all of us him and my daughter to the appointment. Then I'm gonna return home. I'm gonna drop her off at school. Then I'm gonna go back to Philadelphia, and then I'm gonna sit with him through his chemo, and then I'm gonna bring him back home. And in my mind, this seemed like the only option. So I ran this plan by my mom, and she was like, why don't you just ask your neighbor? They go to school together, they ride the bus in the morning, they're friends. Has it never crossed your mind to say, hey, can we drop Hannah off over there in the morning and ride with you? And it seems so simple, but it was really eye-opening to me, because it was like I realized that I do not have to do this alone. And as a caregiver, I think it's really important that you recognize that you do not have to do this alone. And people don't know that you need help unless you tell them. And so I was a little bit hesitant at first. I'm going to be honest, I didn't want to do it because I didn't want to bother anybody. This is our issue. This is our problem that our family is dealing with. And like it's been said, I'm from Alabama. We live all the way in New Jersey. So we don't have family here. We know our neighbors. We've met them. We've gone to practices and games together. But, to say I need help was something that I was really resistant to do. And so I was like, okay, Mom, I'll send her a text. I sent her a text. She responded back immediately. Oh, yes, bring her over here. If you ever need anything, we're always willing to. And it was like, I was grateful and shocked all at once, because in that moment, through that experience, I learned the importance of reaching out and leaning on others. and that others are willing and able, a lot of times they just don't know what it is that you need. So it's really important to put those things to the side. My mom calls it pride. I'm not sure if it's pride. I don't know what that feeling is that prevents you from reaching out to ask somebody for help. But whatever that is, as a caregiver, it's important to place that to the side and let people know, hey, I need help, and it's okay to say I can't do this by myself.
Awesome. Thank you for that. I can agree. It takes a village. When I first told my friends about my dad's possible diagnosis, they were very supportive to the diagnosis, and even afterwards, they were my pillars. They gave me inspiring words. Even when I felt like I couldn't go on, they provided encouragement and reassurance, that you don't have to do this alone. And even, when you think about financially too, like I said with my dad, he was an entrepreneur. He is an entrepreneur. So he didn't have any money coming in. So now I'm stressing, about how my mom is going to carry this heavy load, this heavy burden by herself. But then, I have siblings, so they were able to step in and just pitch in. So it really does take a village. So thank you for that, Ashanti. And I know we talked about some of the biggest challenges, and pride being one of them. And going back to my dad, he didn't even want anyone to know that he had cancer. It was like a plague or something. Like he was just, I guess he felt embarrassed about sharing it. But needless to say, I told everybody. He doesn't know. He knows now, but I told everybody that my daddy was battling cancer because I need grace. I have a lot going on. I can't give you my best self because I'm suffering in another area. So I told everybody, daddy, just to let you know. So on to the next question. What was your biggest challenge you faced as a caregiver? How did you overcome it? How did you maintain emotional resilience during this difficult time? And I know, like you said, pride was one thing, and then Natasha, you also said that your mom was, kind of like your biggest patient, or your worst patient. So tell us about that. And even Nancy, if you've experienced, just watching anyone come in and out of the cancer center, can y'all tell me about that?
Yes, I can definitely tell you about that. One of the biggest challenges I faced as a caregiver for my family member, my mom, was balancing my emotional support with practical giving duties. Watching her, I love watching her go through the pain and uncertainty was incredibly difficult. I had to learn how to manage my own emotions while staying strong for her. I could remember the day like it was yesterday when I got home from work and she called me into the room to say that she was diagnosed with cancer. And I said, okay, mom. And I said, okay, great. And we talked a little bit and I was like, all right, mom, I'm gonna go ahead and go home. And I left out the door and I got into my car and I called my best friend and I was like, my mom has cancer. It was no way that I could show these emotions to her at that moment. And I just bust out crying. And I needed to get out. I screamed, I hollered. And I just had to get that emotion out at that moment. And after that, I've talked to my sister and my brothers, and I'm like, we got this. We're about to fight. I stole this little quote from my friend, and I said, my mom has cancer, but cancer does not have her. And I truly, truly, truly believe that. And once we got our emotions out of the way and we took in, oh, we're about to take this to war, we went to war. And we talked and we prayed and we got together. It was days and nights. Every day that my mom went through chemo, someone stayed with her. If it was me, my daughter, my sister-in-law, somebody stayed with her every single night. Even if it's just sitting there, being there. No one said a word. She wanted somebody there. They have to have that support there to be able to get them through the day, get them through the time. And I feel like if they have somebody, it's so much better. It's so much better to have someone there. During her treatments, there were days when she felt overwhelmed and defeated, frustrated, withdrawn. I found the patients. I was actively listening, simply present there. Managing her medications, appointments, and physical care required me to stay organized and proactive. Also balancing my own feelings of fear, anxiety, grief, while staying strong for her, and being overwhelmed. We often experience burnout, physical and emotional drainage, while juggling medical appointments, household responsibilities, patients' emotional well-being, financial strain, lack of support, and uncertainty of her conditions. I have definitely overcame these things by leaning on my sisters, my brothers, friends, other family members, by, like Ashanti said earlier, asking for help, managing different responsibilities. If I couldn't do it today, my sister did it, or my daughter did it. Our husbands was there helping us throughout the way, taking care of the kids while we were there helping our mom, or they would do things for her, delegating different tasks. We were cooking, we were cleaning for her. We hired someone to come clean the house when she went to have chemo. Just prioritizing self-care, focus on our emotional well-being, expressing our feelings, going to church, praying. We all got together still every Sunday. And then we also celebrating just the small victories. It was mornings where I went to the house and I cooked at 3 o'clock in the morning before I went to work. And just to help her get through the day, just to help her, mom, just eat a little bit. If she had a spoonful of grits, I was screaming and hollering. Like, just being there with them, helping them through the way is definitely great.
Natasha, I want to comment on that. That was a beautiful story, and it was very real and raw, and I appreciate you sharing that. I think you said one of the best things that we need to hear. People do not know how to help unless you ask. That was perfect, because even friends may not know how to act towards their own loved one, or whether it's friend, family, they don't know what to say, what to do. One thing I did like what you said, when you ask, there's things somebody can do who has cancer, and that's write down things that they need help with, like you stated, whether it's somebody to get a meal, whether it's somebody to go grocery shopping, do the lawn, help do laundry. Like you said, come and just do active listening. You don't need to say a lot, but be present. That's powerful. One thing that Cancer Services did, we had an employee who actually created something called Helping Hands, and it's a software program for cancer clients who could actually list jobs and activities that they need to be done on a calendar. And they actually invite all of their friends and family by email to have access to the calendar. And they are able to, friends and family, pick items and do the task, which is great, because then both sides are winning. You know, you're saying, call me if you need me. Well, I'm a cancer client. I don't feel like calling you. I just came from chemo. I'm feeling terrible. I need you to pick up the ball and do something, right? And they can then pick up a task, get it done, and everybody could see who's doing what task. So two people can't take the same task, and it's really good. And all of these, again, are just very important to caregivers, because caregivers need help as well. And it behooves both parties.
And just to jump on at the end of that, another challenge as a caregiver that I experienced personally was guilt. And I say that more when you're working full time and you have children and you have responsibilities and you feel exhausted and you feel overwhelmed and you feel tired and you feel like you don't have a right to feel that way when you look over at your spouse who is going through chemotherapy, who's had this diagnosis, that's going through surgery, and you feel like, and you tell yourself that you're wrong for feeling tired. How dare you feel tired? How dare you feel exhausted when you look over there at someone else who's going through such a worse experience? And that was my biggest challenge, to say that it's okay to feel tired. You can feel tired too. He can be going through something and you can be having a difficult time too. And I think acknowledging and giving yourself grace during this time is really important, because you can carry that burden of feeling guilty for feeling exhausted, because we were in hospitals, we was in and out of hospitals, we were going through chemo, we had appointments, and then I had 3 children and we're trying to keep their life normal. And you're this person that's balancing it all out. And at the end of the day, you feel worn out and tired, and you've given yourself to everyone, and that it's okay to feel normal after that. And I think that's really important to stress to caregivers during this time, is that it's okay to feel tired. It's okay to have these feelings. And you're not a bad guy because you say that you're feeling exhausted too. And I think it's important to give yourself that grace. And during that, that will enable you to, like we said earlier, reach out for help and recognize that you do not have to do it alone. And it's okay. You're still strong in the fact that you requested help.
That was good. And it was a reminder to myself too, because even now, when my parents ask me to do something, I feel like I have to do it right then, because it was at a point a year and a half ago where I thought that I could have lost my dad. So it's like I feel all this extra pressure to just be at their beck and call, but I can't do that all the time. I'm not available all the time. So I definitely understand that. So we can go, have one more question. If y'all can give like any advice to caregivers, or even someone that's going through cancer, or any resources that people may not know about, what would you all share with them?
I'll quickly just say balance. I thought that's important. One thing that I did do recently was I joined the Pilates class, and it seemed like, okay, you already have all these things on your plate. Why are you doing this? Well, I found it very therapeutic, and I was taking care of my physical health. So I found that just finding balance, to find a little time as a caregiver to do things positive for yourself, to keep you in a positive mind frame, will make you better prepared and equipped to take care of your loved ones. Because if you take care of yourself, then you're ultimately able to better take care of them.
Anyone else?
I think on the same page, having that just some total quiet and mental peace, where it may be nature is always good and soothing, whether it's music, really having even if it's 30 minutes a day. Y'all definitely said the same thing. People feel guilty as caregivers because they do, but you have to put something in your tank to keep you going and keep you as a caregiver at your best, because it is trying and it can be exhausting. So just practicing mindfulness, and again, setting boundaries is another thing we have to do, because we're human. We can't go 24/7 without sleeping and eating, and we put ourselves to the side, because if what happens is, as a caregiver, can then fall apart both mentally and physically and with their health. So just keeping that in mind.
I would also like to piggyback on what Nancy and Ashanti just said. Definitely balance, still being able to do things for yourself, going to your own doctor's visits, still being like, things I've done was we'll still have a little date night with my husband, or going out with friends, just to kind of get away for like an hour and a half or 2 hours, and still having that support system, to be able to come to work, even to sit and talk to my coworker about what was going on. That definitely helped me a whole lot. Or even just taking the kids to the park. just to be able to still have some type of normalcy in your life. So I definitely think that that was something that helped me through the way, and my mom.
Awesome. Thank you, ladies, so much. This was so beneficial. I believe we have a few questions in the chat. So we're going to do a couple of questions and then we'll talk about the resources and takeaways from this event. So, first question, is there a location or residence restriction for cancer services?
Okay, that's a great question. As long as the client actually lives in one of our 10 parish areas, and that was in, the list is in the PowerPoint presentation. And we could also get that to you, as long as they're seen by a physician within our Baton Rouge area, they are allowed, to become a client. And again, they have to have that cancer diagnosis. Those are the two requirements.
Awesome, thank you. And we also have a list of resources that we're going to provide in this webinar and when we send out the email for those who may not stay in Louisiana. Next question, what should be the first resource a family looks into for help during this difficult time? And that could be from personal experience.
If they've been diagnosed with cancer, definitely reach out to cancer services, because we also can provide some additional services once we get here, because we do work with nonprofits as well. Because it definitely takes a village, because there are going to be many different variables that come up.
Okay. Anyone else on that question? If not, we have, how does nutrition play a role in cancer prevention and recovery?
Nutrition definitely plays a vital role in cancer recovery. Just watching what you eat, and it plays a role with actually everything. Watching the things that you're eating, putting in your body. Definitely fruits, vegetables, plenty of water. Is a very vital source of our everyday lifestyle that we need to have. We know that it's, a little bit more expensive, but as a lifestyle and to eat healthier, exercising plays a vital role for this.
Awesome, thank you. Last question, how can caregivers better advocate for their loved ones in a healthcare setting?
I would say stay informed, learn about your loved one's condition, treatment options, medications. Always ask questions, speak up. Don't be afraid to ask for clarification if you don't understand something. Make sure you keep detailed records, maintain a log of the symptoms, medication, test results, and doctor's notes. Know your patient's rights, be present and engaged. You want to attend the appointments, take notes, and communicate with the care team. Build a relationship with the care team, a positive, respectful relationship with the doctors and nurses and other staff. When providers see you a collaborative partner, they're more likely to be responsive. And also take care of yourself too. Advocacy is demanding, and a burnout can affect the caregivers as well.
Awesome. Thank you, ladies, so much. This has been so good for my soul, beneficial for me. So I hope those of you who are watching, it has been beneficial to you all as well. So now we're going to get into our resources and takeaways from this event. Thank you, ladies, so much. All right, so some of the main takeaways for this event, we want to just provide practical strategies for balancing caregiving responsibilities with personal and professional commitments, information on accessing resources, whether it be financial, emotional, or medical support, and also the importance of creating, not creating, but the importance of having a village that can support and help you throughout this process. So here are some resources that we have. And like I said, we will email this to you all. You can't really see it, but we have on here Cancer Services of Greater Baton Rouge, the Baton Rouge General Medical Center Cancer Support Services, the Women's Hospital, the American Cancer Society, Louisiana Cancer Prevention and Control Programs, Our Lady of the Lake, Live Strong Foundation, the Pan Foundation, Cancer Hope Network, and the Well Spouse Association. And now I'm going to hand it over to Michelle.
Thank you for that, Maddie. I want to highlight the Louisiana Cancer Prevention and Control Programs. It is a statewide Louisiana Cancer Prevention Program, which is one of our partners with Louisiana Public Health Institute and Louisiana Cancer Research Center. Their mission is to eliminate suffering and death in Louisiana by focusing on cancers that can be prevented or detected early and cured, specifically breast cancer, cervical, and HPV-related collateral and lung and tobacco-related cancers. They have Caring Through Cancer training series and roundtables. Their next one is March 12th, 1 to 2 p.m., body image, and then March 25th from 12 to 1, diet, exercise, and reinventing routines. That information will also be sent in a follow-up email after this webinar. Again, we want to thank you all for attending today's webinar. For those of you that are on that are seeking social work and MCHES, continuing health education specialist, master continuing health education specialist, not continuing certified health education specialist, my apologies. When you answer the survey that is after this webinar, it will also be in a follow-up email. Answer the survey. Everyone that's on this call, on this meeting, please answer the survey. Give us your feedback. And those that are seeking the CEUs, if you answer the survey, enter your information, you'll get your certificates within 5 to 7 business days. And again, thank you all for attending today. Thank you again to our participants for being on this webinar, and we hope everyone has a wonderful Thursday afternoon.
Thanks, everyone.
Thank you.